Hi, this is Hester Vaughan of Lifestylecoach Financial Services, and this is a quick video to discuss the changes, some of the high-level changes for Discovery Health 2026. I've made some notes, and also I wanted to touch on a few things that we forget about, that we've got as benefits, and so I just wanted to mention those so that we don't, not use them. So the weighted average across all the plans is 7.2%, the increase for next year, for 2026. And the good news is that they are only bringing that increase out on the 1st of April. So that is, so you've got the first few months free. So basically, it kind of makes the weighted average about 5.4% for the year. So that's for next year. Then they've brought out a new plan, the Classic Smart Saver plan. So it's like the Classic Smart, which is my favorite plan on the whole chassis of Discovery Health. But now they've added a bit of a savings benefit to it. I've got a special video on that, of whether I think it's worthwhile or not. And I do a comparison between that and the Essential Delta Saver plan. Those two, the Classic Smart and the Essential Delta Saver, are my two favorite plans. So do check out, just have a look at those videos if they're interesting to you. And yeah, then I'll do a comparison as to what I think about the Classic Smart Saver. Then just very quickly, so there's changes to the Vitality, so I'll do that on a separate video. And there's changes. One of the biggest things I just wanted to concentrate on, but I've made a special video for it, is the personal health pathways. So they started it in, I think it was in COVID, actually. No, after COVID, when they made such a big profit because nobody was going for medical interventions during COVID. They couldn't. So they made a profit, and so they paid it out to all the members in the following year, and they called it the Personal Health Pathways. They've really expanded on that. So for next year, it's Personal Health Pathways and Challenges. So I've done a video on how to use those, but just be aware of them, because if you don't, you are losing out on money that you could make. I mean, it's anything from 2,000 Rand extra into your medical savings, or even if you don't have a medical savings on a core plan, you can have this amount of money, right up to 24,000 Rand extra for the year for a family if you're on the executive plan, by just doing some of the things that they tell you to do. So it's kind of like AI driven. They look at your specific medical history, and then say you should go for that, or you should do this checkup. So that's what the Personal Health Pathway. So I just wanted to mention that. So if you're not familiar with them, or you're not using this, please go and look at that video and learn how to make use of that, because that's just money that you're losing out on. Then I've just made some notes. There's a for the health app, the Discovery Health app is being quite advanced. There's an AI check your symptoms. So it's like Googling Dr. Google, but it's a little bit more specific and accurate, I'm imagining, because it's on the health app. There's a panic button that you can use for Discovery emergencies. Any emergency, medical emergencies. There's a Parent Sense, which is an enhanced maternity support that they've brought out. There's virtual physical therapy once it's prescribed. So it's got to be prescribed by a physio or a chiro, I think it is, or a GP. And then you've got a whole virtual system, and it's paid for out of your MSA, but it will go a long way to, it gives you great support for physical therapy. There's a digital mental care. If you are prescribed this, it's if you've been diagnosed with depression. They really are focusing on depression next year as well. So there's an online digital mental care that they are using. So it's it either gets paid for from the hospital plan, or otherwise it's going to come out of your MSA, but still cheaper than. Not cheaper, but it's just something that you can use as well as having a therapist, because you can never replace that. Then there's a virtual urgent care, like instead of going to the emergency room, you can have a consult with a doctor online, which I think is really handy. And that's 4 per family per year, but you've got to meet the clinical assessment. So it's not just, I've got a sore toe, can I see a doctor online? It's literally, it would be like you would rush to the emergency room for that. But before you do that, you can have a virtual consult. So it's got to be fairly urgent. And then you have 4 per family per year, which is nice. Then don't forget all your screenings that are paid for by the hospital plan. which are mammograms, prostate tests, HPV, and bowel cancer checks. So please don't forget to do those screenings. They're paid for, so use those. And then the mental health care program. This is new for next year. You have to be enrolled by a psychologist or a GP, and it's for episodic depression. They will pay for some prescribed meds. There's group or individual psychotherapy consults covered, virtual and face-to-face. So this is really good news. It's a definitely enhanced mental health care package. This is over and above your normal 21 days in a clinic or 15 outpatient visits. This is over and above that. And it also does digital mental health. There's that program that I mentioned before, the digital mental health, and it's CBT, cognitive behavioral therapy online, and some extra GP visits, plus a relapse prevention program, which is some extra psychiatry consults. So yeah, it's a lot better, a lot more care for mental health, which is great. So if you need to know anything specific about it, you can always contact my office and we will get you more information on this. And then the mental health PMB, I just wanted to go through that again. That's what I just described. It's either 21 days in a clinic for major affective disorders. It's 21 days for major affective disorders, 21 days for anorexia, and 21 days for bulimia. So if you have got all three of those things, it's 21 separate days for each one of those conditions. And for those conditions, you either go into a clinic or 15 outpatient consults. So that's how the mental health system works. Then there's also, this is new, 12 out of hospital consults for acute stress disorder accompanied by recent significant trauma. So if you've had a recent significant trauma and you've been diagnosed with acute stress disorder, there's 12 outpatient visits over and above. So that's really nice. That's a new thing. And then there's 3 days in a clinic for attempted suicide. And then for all other mental health admissions, it's 21 days in a clinic only. No, you don't have the options for the 15 outpatient visits. So then you only have, I'm not even sure what those mental health admissions are, but I just wanted to make a distinction that it's only for the major affective disorders like major depression disorder, anorexia or bulimia, that you've got the choice of going in a clinic for 21 days or 15 outpatient. But for all other mental health admissions, other than those, you can only go into a clinic. You don't have the 15 outpatient. And all members on Discovery Health have got access to 2 trauma counseling sessions. So I just want to mention these things to you because we forget or we don't know that we have these benefits. And so, as I said, if you have any specific questions or you would like some advice on your specific situation, please contact our office and book a call with me and I'll go through that with you. Hope this has helped. Thank you.